Hello everyone, welcome back to my channel. My name is Pinky. I'm the clinical pharmacist practitioner. Today I'm going to discuss about excessive sweating. Medical term is hyperhidrosis. Now, I have seen patients coming and telling me that they're sweating so excessively that they have to change the dress twice a day and the sweats drips off their hands. Now, that's interesting, isn't it? So, how do we manage excessive sweating in primary care? Now, sweating can be of two types. One of them is primary hyperhidrosis. Now, in primary hyperhidrosis, all over the body there will be sweating. It is going to be symmetrical sweating. And in secondary hyperhidrosis, the sweating can be due to an underlying medical condition or medicines, such as chronic infection, tuberculosis, malaria, then menopause, diabetes, hyperthyroidism, excessive growth hormones, drugs such as alcohol, cocaine, heroin, some antidepressants, antifungal medication, acyclovir, antibacterial medications such as ciprofloxacin, and excessive sweating can be also due to anxiety and obesity. So how do I diagnose primary hyperhidrosis? Now, in order to diagnose primary hyperhidrosis, I'm going to ask the patient, how long have you been suffering from this excessive sweating? Now, if it is more than 6 months or at least 6 months and without any reasons and with two of the following features, the features are it has to be both sides. Okay, if it's this armpit, the sweating has to be on this armpit as well. So it has to be symmetrical and it impairs the daily activities of the patient, and there is one episode of excessive sweating in 1 week, and the age onset is less than 25. And if there is a family history and these are the symptoms, features, I'm going to ask the patient. In order to rule out secondary causes of hyperhidrosis, excessive sweating, I will request for some blood tests such as full blood count, kidney function test, liver function test, thyroid function test, erythrocyte sedimentation rate, which is an inflammatory marker in the body, and I will also request for random glucose check to rule out if there is any secondary causes. I do offer my patients some lifestyle advice to begin with. I will advise them like avoid spicy food, avoid alcohol, and try to relax, like avoid emotional, stressful triggers if possible, and use antiperspirant rather than deodorant, and wear loose-fitting clothes made of natural fibers, basically cotton clothes. Now, however, most patients have already, in general, most patients have already tried all these lifestyle advices and then they would have come to me for help. I often advise my patients to try topical aluminium chloride, which can be applied at night to dry skin and rinse off in the morning. And it can be used with antiperspirants. Now, with aluminium chloride, 12.5% can be used to start with. And if there is no improvement after 6 weeks, then 30% can be used. And the classical side effect of topical aluminium chloride is skin dryness, and there can be irritation. If patient is still distressed, then I will offer some options such as ionophoresis, where a specific current, electric current, is passed through an ion medium rich content, and the body part which is sweating excessively is placed in that ion rich medium, and this is how the treatment is done. And basically this treatment needs to be carried out weekly. It's an ongoing treatment and the patient has to buy a kit. Other options can be anticholinergic tablets, glycopyrronium tablets. Botox can also be used. Another option is endoscopic thoracosympathectomy. And for this, obviously, I need to refer the patient to a dermatologist. And the most important thing is it can be very distressing, and obviously, as a healthcare professional, I have to understand the patient's distress and try my level best to help them in each and every way possible. Thanks for watching. I hope this has helped you a lot in understanding what excessive sweating is. And yeah, do like and subscribe my channel. Support me, motivate me, and stay safe. Thank you.